Does it ever feel like there's a pebble stuck in your shoe, even when nothing is there? Or maybe you get that sharp, burning pain in the ball of your foot that shoots into your toes. That's not just foot soreness. It could be Morton's Neuroma. And here's the surprising part. There's actually a simple way you can check right at home if your pain is possibly Morton's Neuroma. I'll show you that quick screening test first, and then walk you through our 5-step treatment method that helps fix it and get rid of that pain. Hi, I'm Dr. Ole Olson, America's neuropathy coach and founder of Asuta Health Neuropathy Centers. This is one of the only channels on YouTube entirely dedicated to helping people with peripheral neuropathy finally get lasting relief. Subscribe now if you're looking for natural relief, proven daily routines, and real-world solutions that actually work. You're in the right place. At Asuta Health, we help you move better, feel better, and live with less pain every single day, because you matter. So here's a test you can do at home. Sit down, take your shoe off, and with your thumb and fingers gently squeeze the sides of your forefoot. This is called the metatarsal squeeze test, or Mulder's click test. If this reproduces the sharp, burning, or tingling pain you've been feeling, or if you notice a click or snap sensation, that's a strong sign that it may be Morton's Neuroma. Now, this is just a screening test you can do at home. You should still get checked out and evaluated by your primary doctor. However, it is a good starting point, and this simple test gives you a clue before you even see a doctor. Now that you know how to check, let's go through the 5 steps to actually treat and relieve this pain. Stay with me because step 4 is the breakthrough that finally gives long-term relief. In a moment, I will outline our 5-step Morton's Neuroma treatment protocol. But first, let's review what Morton's Neuroma is. And then you will see how each part of this treatment protocol is specifically targeted to not just relieve the pain for good, but also address underlying reasons that could have contributed to Morton's Neuroma. Morton's Neuroma is a thickening of the tissue around the nerve, between the toes, most commonly the 3rd and 4th toes. It causes sharp, burning pain in the ball of the foot, often with tingling or numbness that can spread into the toes. Many people describe it as if they're standing on a pebble inside their shoe. This condition can make it difficult to walk long distances, to wear normal shoes, to exercise, or even to stand for extended periods of time without discomfort. It often limits daily activities, creates ongoing frustration, and for many people, the pain keeps coming back despite trying different shoes or other quick fixes. That's why at Asuta Health we use a 5-step treatment protocol designed not only to relieve the pain, but also to correct the contributing factors so you can return to normal activities with lasting comfort and confidence. Before we go into the 5 steps, let's talk about the big picture. The goal of this treatment protocol is to reduce pain, stimulate healing, and provide the right foot support to prevent Morton's Neuroma from ever coming back. Now let's break it down by step 1, breaking up the adhesions. One of the hidden reasons Morton's Neuroma becomes so painful is because of adhesions. Adhesions are bands of scar-like tissue that form around that irritated nerve and the surrounding soft tissues in the ball of your foot. When that nerve is constantly compressed between the metatarsal bones, these tissues start to stick together. Instead of gliding smoothly, they bind and tighten. This creates 2 big problems. First, adhesions trap the nerve, which keeps it irritated and inflamed. Second, they restrict normal foot mechanics, so every step continues to aggravate that neuroma. That is why breaking up these adhesions is the very first and most important step. At Asuta Health, we use targeted soft tissue release techniques, such as myofascial release. This involves applying precise tension and movement to separate the stuck tissues and restore mobility. Another effective method we use is called the Graston technique, which uses a specifically designed handheld tool to gently break down scar tissue and adhesions. Both approaches help free the nerve, reduce pain, and restore normal movement in the forefoot. When adhesions are released, the nerve finally has space to move and heal. That sets the foundation for the next step, which is all about increasing blood flow to accelerate recovery. Step 2, increasing blood flow. Once adhesions are broken up, the next priority is circulation. Poor blood flow is one of the reasons Morton's Neuroma lingers and keeps coming back. When the small blood vessels in your forefoot are not delivering enough oxygen and nutrients, the irritated nerve cannot heal properly. By boosting circulation, we give the tissues exactly what they need to repair and calm down. One of the ways we do this is through targeted exercises that improve circulation in the feet and the toes. Examples include things like ankle rockers and seated heel lifts combined with toe spreads. These movements activate the small muscles in your feet, encourage blood flow, and promote nerve healing. I've created several videos that demonstrate these exercises step by step. You can find the links in the videos in the description below. Another powerful method is red light therapy. Red light penetrates the tissues, stimulates the mitochondria inside your cells, and enhances energy production. This creates an environment where tissues can repair faster and inflammation can be reduced. Red light therapy has been shown to improve circulation and accelerate healing, making it especially effective for Morton's Neuroma. I've dedicated an entire video to red light therapy that explains it in detail, so be sure to check that out in the description below. We also use whole body vibration therapy. This involves standing on a vibration platform that creates small, rapid movements through your body. Those vibrations stimulate circulation in the legs, feet, and toes. With better blood flow, oxygen and nutrients reach the irritated nerve more efficiently, which helps reduce pain and promote recovery for Morton's neuroma. Improving blood flow gives your body the power to heal, and when circulation is restored, it sets us up for the third step, which is reducing inflammation around the nerve. Step 3, reducing inflammation naturally. Inflammation is at the core of Morton's neuroma pain. When the nerve between the toes becomes irritated, it swells. That swelling creates even more pressure inside that tight space of the forefoot, which keeps the nerve irritated and painful. If inflammation is not addressed, it becomes a vicious cycle of swelling, irritation, and then more swelling. This is why reducing inflammation is a key part of our treatment protocol. We focus on non-drug solutions to reduce inflammation naturally and safely. The first step is cleaning up the diet. Pro-inflammatory foods such as refined sugars, processed oils, and heavily processed packaged snacks all contribute to inflammation from the inside out. By removing or reducing these foods, we reduce one of the hidden drivers of chronic inflammation in the body. At the same time, we encourage patients to add anti-inflammatory foods into their meals. Foods rich in omega-3 fatty acids, such as flax seeds, walnuts, and salmon, as well as colorful vegetables and leafy greens, which provide nutrients that calm inflammation and support the body's healing processes. We also recommend certain natural supplements that have been shown to reduce inflammation without the side effects of many drugs. Options like curcumin from turmeric, as well as omega-3 fish oils, are well studied for their ability to reduce inflammation and support tissue healing. In our clinic, we also use a leading technology called soft wave therapy. Soft wave has been shown to improve circulation, reduce inflammation, and stimulate tissue regeneration all at the same time. This is a major breakthrough for Morton's neuroma care. And in the next step, we will take a deeper dive into exactly how soft wave therapy supports stem cell activation and long-term healing. Reducing inflammation calms the nerves. It lowers pain and prepares the body for deeper tissue repair. Once inflammation is controlled, we can move into the next stage, which is activating stem cell production for healing. Step 4, activating stem cell production for healing. Once adhesions are released, circulation is restored, and inflammation is calmed down, the next step is to stimulate deeper repair. This is where soft wave therapy comes in. Soft wave therapy is the breakthrough method in our protocol. It uses advanced electrohydraulic acoustic waves that penetrate deep into the tissues and trigger a powerful healing response. This stimulation improves circulation, releases growth factors, and most importantly, it activates dormant stem cells in the area. Stem cells are your body's natural repair cells. Once activated, they begin regenerating damaged tissue, calming irritated nerves, and accelerating recovery. It has also become a patient favorite because it is non-invasive, comfortable, and many people notice relief even after their very first session. Patients love that it feels gentle, yet it works at the root cause rather than just masking their pain. What makes soft wave unique is how it works in synergy with the earlier steps. The tissues are freed, blood flow is improved, inflammation is reduced, and now soft wave drives a deeper healing that ties it all together. For Morton's neuroma specifically, soft wave helps by regenerating the tissues around the nerve, reducing pain and irritation, and restoring a healthier environment for long-term recovery. Many patients experience faster healing and lasting relief when soft wave is included in their care. Now that healing is activated at a deeper level, the final step is protecting your results with custom orthotics, so the Morton's neuroma does not return. Step 5, custom foot orthotics. Everything we've talked about so far has been focused on stimulating healing from the inside out. Now we need to look at the other side of the equation, supporting the arches and structure of your feet from the outside. If this piece is neglected, it can be one of the key missing links that not only contributes to Morton's neuroma, but also allows it to keep coming back even after the pain has been relieved. A normal foot has two important arches: the longitudinal arch, which runs along the inside of your foot from heel to toes, and the metatarsal arch, which runs across the ball of your foot just behind the toes. These arches are designed to absorb shock, distribute weight evenly, and reduce pressure on the nerves. When the opposite of normal arch support occurs, problems follow. A collapsed or flattened longitudinal arch changes foot mechanics, creating excess strain with each and every step. A collapsed metatarsal arch can narrow the space between the metatarsal bones, directly irritating the nerves and contributing to Morton's neuroma. This is why even if the nerve is healed and the pain feels gone, if the abnormal foot structure and mechanics are not corrected, the problem can return. Think about how often you're on your feet, every day, all day, throughout your entire life. The cumulative effect makes an arch support critical. That is why a foot biomechanical exam and gait analysis are essential. If we find imbalances or collapsed arches, we can address them with custom orthotics designed specifically for your feet. Custom foot orthotics are built to restore proper alignment and support where your feet need it the most. If the longitudinal arch of your foot is collapsed, the orthotic gently lifts and supports it. If the metatarsal arch is dropped, which is a common contributing factor to Morton's neuroma, a built-in metatarsal pad redistributes the pressure and protects the irritated nerve. The result is a custom orthotic device that not only supports healing, but also prevents reoccurrence by keeping your foot mechanics balanced for the long run. You will find that custom orthotics can provide the most reliable way to protect your results and keep you walking comfortably for years to come. Lasting relief from Morton's neuroma is never about just one thing. It's the combined synergy of all 5 steps, breaking up adhesions, increasing blood flow, reducing inflammation, activating stem cell healing with soft wave therapy, and then protecting those arches with custom orthotics. Together, these create an environment where the nerve can finally heal and stay healthy. If you're suffering right now, know that healing is possible. Look for a doctor or therapist who has real-world experience treating Morton's neuroma and who can apply all 5 of these steps. At Asuta Health, we have successfully helped many patients who are struggling with the pain of Morton's neuroma. We have 4 clinics across the Midwest. You can check out our locations in the description section below. If you're in the area, we would love to help you because you matter. If you found value in this video and learned something new, please like and share it so that more people with foot pain can discover safe and effective ways to heal. Also, if you have any questions about what we covered today, go ahead and drop them in the comments below. I read and respond to as many of those as I can. And if you want to learn the difference between Morton's neuroma and peripheral neuropathy, which can often be confusing at first, go ahead and check out this video here called Solving Toe Pain Confusion, Morton's neuroma versus peripheral neuropathy. Go ahead and watch this video next.